Good afternoon, everyone. A very warm welcome to our attendees joining us live today from different places. We are delighted to have you with us for this insightful session titled Laser Logic, Myths, Mechanisms, and Mindset in Proctology, brought to you by Onus Robotic Hospitals, Hyderabad. I'm your host for the session, and it's my pleasure to introduce our distinguished speaker, Dr. Raghuteja Padma, laser laparoscopic and general surgeon at Onus Robotic Hospitals. Dr. Raghuteja is known for his expertise in advanced laser and minimally invasive surgeries and for his patient-centric approach that blends technology with compassion. In today's session, he'll help us understand how proctology he'll help us understand how laser technology is revolutionizing proctology, clearing up common myths, explaining the true mechanisms behind it, and helping us shift our mindset towards modern, effective, and precise surgical care. So before we begin, a few quick reminders. You can post your questions in the Zoom chat box. We'll take them up during the Q&A session at the end. Don't forget to fill out the post-webinar survey that will pop up after the session. Your feedback would help us help serve you better. So without further ado, let's get started. Please join me in welcoming Dr. Raghuteja Padma for his session on laser logic, myths, mechanism, and mindset in proctology. Over to you, doctor.
So thank you so much, Ajay. Can you see my slide or PPT?
Yes, doctor. You can start the slideshow.
Just a second.
Yes.
So is it clear?
Yes, doctor.
So coming to the laser logic, myths, mechanism, and mindset. So there are a lot of myths related to laser, mainly proctology, and many people don't know like what mechanism does laser have, like how does laser cut the tissue in surgical cases like in proctology, or how does it helps in varicose veins as well. So that will crack in this webinar mainly. So laser logic, myths, mechanism, and mindset. Myself, Dr. Raghuteja, a laser and laparoscopic surgeon from Onus Robotic Multispeciality Hospital. So I did my fellowship in laser and laparoscopy from Coimbatore. So I have immense experience for last like 8 years in this. So coming to the introduction part, modern proctology has evolved from painful invasive methods to minimally invasive logic driven treatments. So previously there will be there used to be like traditional type of surgeries. We used to cut the entire tissues and there will be like a lot of bleeding from the tissues. Now, so laser helped in precision mainly and comfort, quick recovery from the disease. Like, just give me 1 second. I don't know. Okay. Can you see me, Ajay?
Yeah, doctor.
So laser, it helps in one, precision, then comfort and quick recovery. These are the three most important pillars or most important points pertaining to laser, which helps in quick recovery of the patient. So what are the facts and myths related to laser surgery? The common myths which patients have like or laser means completely painless surgery. This is a myth because there will be some sort of pain even in laser because however we are cutting the tissue, there may not be bleeding as much as like traditional surgeries, but Sometimes, however, we are cutting the tissue, that may lead to pain post-op. And one more important thing for pain is like that the tissue we are cutting, where we are using the laser, is like very sensitive area, because anal tissue, hemorrhoids mostly happen at the anal region, like hemorrhoids or fistula or perianal abscess. So it is very sensitive area. So there will be definitely some sort of pain even if we do laser surgery. Laser surgeries have zero recurrence. Again, this depends on the like grades of the hemorrhoids. Say for example, grade is 3 or grade 4. Some people come with like prolapsed piles. So these patients, what we can do is will take like 2 or 3 sittings to excise the hemorrhoids. Sometimes we'll excise the entire hemorrhoid. Sometimes we'll decide whether it is involving the sphincter or not. So some like patients will have constipation. These patients post-operatively, they may have recurrence sometimes. It also depends on the expertise of the surgeon who is operating, who is like handling the laser. That is very important. So most of the times, 95 to 98%, there will not be a recurrence, but sometimes due to excessive constipation, or if the patient is not following proper instructions of the surgeon, there may be chances of recurrence even if it is done through a laser. Then every fissure, fistula, or hemorrhoid must be treated with laser, or not necessarily, because sometimes if the hemorrhoid is like prolapsing grade 4 hemorrhoid, what we do is we'll excise the prolapsing pile with laser, and will ligate the main blood vessel. So, and even for fistula, if there are like 3 to 4 tracks, sometimes it is not very much easy to excise the fistula with laser. So then we may try like excision of the tract, that we call as fistulectomy with the blade or conventional type. So not necessarily every time we use laser. It depends on the surgeon when to use laser, when not to use laser, when to use the knife, when to use the laser. This is the decision of the surgeon. It depends on the grade, it depends on the patient, and when the patient has approached to the surgeon. So any doctor can perform laser procedures. This again is a debate. No, according to me, because it needs a lot of expertise. It needs the like how many cases we deal with laser, because there is a sphincter, internal and external anal sphincter. If some disturbance happens to that sphincter without expertise, there may be high chances that the patient may have incontinence of stool. So that is very important. Expertise is much plays much more role. One in saving the sphincter, two in avoiding the recurrence. So laser is only for cosmetic benefit. No, no, not at all, because laser is not for cosmetic benefit. It is for the relief of the patient. It creates like the area where we use the laser is one hemorrhoids, that we call as piles, fistula, and fissures, and perianal abscess sometimes, and varicose veins. So all these are painful conditions or irritating surgical pathologies. So these are not for cosmetic benefits. These are for proper relief of the patient. Laser helps in excellent relief of the patient. So reality is laser is a tool. Its success depends on case selection, technique we are following, and the surgeon's understanding. So as I already said that it is the surgeon's decision when to use the laser and when not to use. And the technique, different surgeons follows different techniques. So that is very important. Like some surgeons, they'll just excise the laser, burn the dilated vessel, and that's all. Some surgeons, they'll burn the dilated vessel and they'll take the stitch from the vessel as well. So they'll properly ligate the vessel through the suture material. So there are different types of techniques different surgeons follow. It all depends on expertise. So how does laser works? So this we need to discuss. Like many people don't know how a light cuts the tissue. So what does laser do? Is laser is amplification. So whenever we are kids, we used to play with that magnifying glass, right? That magnifying the sun rays fall on the magnifying glass, and that light rays which are coming from the magnifying glass, they will burn the underlying paper. So in the same way, laser is like a the rays which are falling on the tissue, they are not haphazard. They are like properly arranged rays, light rays, properly arranged beam of light rays. They are focused precisely on the tissue. So laser emits a monochromatic, coherent and co-limited beam of rays which falls on the tissue. So what happens whenever the rays fall, that is those rays are absorbed by the tissue. Say for example, it is a pile. The pile will absorb the rays. Now what happens? This absorbed energy is converted into heat. So heat, whenever it converts into heat, the tissues which are there, the pile, for example, a pile is a tissue. That tissue or cells has some water in it. So this heat will be in connection with that water in the tissue, which leads to water vaporization. This vaporization leads to denaturation of the tissue and coagulation. So this is how laser works. You see, there is absorption first from the laser, then coming to heating, local temperature, then vaporization leading to coagulation of the tissue. So this is how laser works. So first absorption, laser energy is absorbed by the water and hemoglobin. Then local temperature rises rapidly, which leads to vaporization, then coagulation, then the heat which is formed there also leads to the healing of the tissue. The blood vessels will be healing. So advantages of the laser surgery in proctology, as we all know, one important thing is minimal bleeding, because laser helps in coagulation. Due to coagulation, there will be very much minimal bleeding from the tissue. Second is less post-operative pain. Why? Because we are precisely cutting the tissue. We are not excising the entire tissue over there. Precisely exact tissue we are cutting. So there will be less post-operative pain. Second, healing. Faster healing and return to normal life. So the healing will also be it is very much fast when compared to conventional surgeries, and this helps in return to normal life of the patient earlier. So again, one more important thing is lower infection risk. Why? If there is a large wound creates an environment for the bacteria or external environment to enter the bacteria or viruses or fungus or parasites into the wound much more when compared to the smaller wound. So in laser, the wounds will be smaller. And one more thing is bleeding. Whenever there is liquidity or blood or water, there are high chances of entry of organisms from the external environment into the wound. So in laser, there is less bleeding, which helps in lower infection rate when compared to conventional surgeries. So outpatient or daycare procedure. And again, one more important thing is we'll discharge the patient on the same day or the next day, just one day, because wound is smaller. Bleeding, there is no post-operative bleeding or operative bleeding. Third, there is less infection rate. So all this helps in discharging the patient earlier. So enhanced patient comfort and satisfaction. At the end of the day, any hospital or any surgeon will claim for one important thing, patient satisfaction. So with laser surgery, yes, definitely patient satisfaction and comfort will be the next level. So advantages of laser surgery in proctology, already we have discussed: reduced pain, quicker recovery, minimal bleeding, lower risk or infection complications, any type, right? Even recurrence also when compared to conventional surgeries. Yes, laser has low recurrence rates. So mindset or surgeon's approach towards laser surgeries. Modern proctology is not about using laser everywhere. For every surgery will not use the laser. It is about the logic when to use the laser. It is very important for which grade hemorrhoids we need to use laser, when we need to use staplers. So this all depends on surgeon's expertise. So that is very important. The logic of applying laser is so important. So right mindset involves understanding patient anatomy and expectations. So what is patient expecting? Pain-free or bloodlessness or to avoid recurrence? Even from surgeon point of view, he'll think from patient's side also. Surgeon, however, he wants the patient not to have any discomfort during the surgery or after the surgery, and he will think, surgeon will think in this way, like he should not get recurrence. That is the main important thing surgeon thinks. Any surgeon things when coming to the pathology of hemorrhoids or whatever. So that is very important, understanding patient anatomy and expectation, selecting the right cases for laser. So again, if it is a grade 1 hemorrhoid or grade 2 hemorrhoids, so laser may not work for that. So either sclerotherapy or like just lifestyle changes works. Some people just for grade 1 and grade 2 piles also, they will operate like laser surgery. They will take the patients. This is all, these are like unethical practices. So when to operate, when to use laser, when to advise lifestyle changes, when to advise stapler hemorrhoidectomy. So all these depends on expertise of the surgeon. So that is very important. Patient need to select his surgeon very much carefully. Whenever we are ordering something in Amazon or Swiggy or wherever on online platforms, we will do lot of research. Even to watch a movie, we'll have a lot of reviews about the movie, then we'll go to that movie. So why not for your body? Or if you, whenever you are submitting your body to a surgeon or to a doctor or to someone, you need to do lot of research. So who is better in treating this type of conditions? Why? So this is very important. Like patient need to select his doctor, selecting the right cases for laser, balancing innovation with ethics. So that's what I have discussed already. So when laser is definitely an innovation, good innovation, but whether to use it or not and when to use it is very important. Continuous learning and training, again, there are a lot of different types of variations, techniques different surgeons follow. You need to attend the CMEs meetings and even to follow the online videos. Then definitely there will be some sort of improvement in learning curve. Prioritizing outcomes and not popularity, this is very much important. Just to showcase yourself, no need to operate on everyone. We need to prioritize uh, like when to do, when not to do. So myths versus logic. One is laser means painless surgery. Logic is pain is reduced but not zero. So don't think you will not have pain at all. There will be some sort of discomfort or pain. The pain will be less when compared to conventional surgeries. The myth is laser cures all anorectal problems, and the logic is each case requires clinical judgment. So it doesn't need to be like if it is an anorectal problem, it has to be treated by laser. No, this has to be decided by a surgeon clinically. Proper judgment saves a life of the patient, or saves lifelong discomfort of the patient, I need to say. So one myth again is laser has no recurrence at all, but the logic is technique and follow-up define recurrence rate. So how is a follow-up? whether he's having constipation, whether he has followed the instructions of the doctor or not, and what is the technique surgeon has followed, and even the expertise of the surgeon is very important. So myth, laser is the trend. Logic is laser is a tool guided by science and skill. So it is one of the tool to do better performance, to bring the better performance of the surgeon. It helps surgeon, it helps patient, but it is not a trend. Just because everywhere you're listening about laser, don't just go and this is my advice to the patient. They themselves come and decide that I need laser surgery, I need stapler surgery. So you leave that to the surgeon. Let the surgeon decide what exactly to be done for this type of pathology. So that's decided by surgeon. So pathology, this is what future of laser proctology, integration with AI and imaging will help definitely. So future of laser proctology, integration with AI and imaging for precision targeting. Already we do this for fistulas like videoscopy and all. Standardization of laser protocols, patient-specific wavelength selection is very much important. Because if it is a fatty patient, obese patient, then the wavelength may vary. And depending on the grades also, wavelength may vary. So enhanced post-surgical recovery protocols has to be made. So laser will evolve as a logic-based, patient-centered tool in modern surgery. So it has to be logic based and it has to be patient centered tool. So laser logic, myths plus mechanism plus mindset. Laser is not a trend. It is a technology that requires logic, precision, and responsibility, which is very much important. A skilled proctologist uses laser as an extension of the not as a light. So this statement, young surgeons, uh, I'll just, it is like a suggestion, or because young surgeons who are upcoming, so they just use laser just like that for even grade 1, grade 2 hemorrhoids, or just excise the hemorrhoids with laser and just leave it. Because we have seen recurrent patients coming to us with a lot of issues. So that is what we should not use laser just like a beam of light. It has to be used by a skilled surgeon or under guidance. Then it has to be like you need to judge when to use laser and when not to use. So thank you so much. If you have any questions, we can.
Thank you so much, Dr. Raghuteja, for that truly enlightening and thought-provoking session. You beautifully helped us understand how laser technology in proctology is not just about precision, but also about patient comfort, faster recovery, and breaking long-held myths. Now, we'll move on to our Q&A segment. We've received several interesting questions from our participants in the chat box. Let's take a few of them for Dr. Raghuteja to answer. Doctor, the first question we have is, can laser treatment completely cure conditions like piles or fissures, or is there a chance of recurrence?
So chances of recurrence that already I have discussed, it depends on the grade of the hemorrhoid or fissure which they are suffering from, chronic fissure. So it doesn't depend on a laser itself. It depends on the patient, depends on the grades, it depends on the surgeon as well, or expertise of the surgeon, I can say. So not necessarily there will not be any recurrence. Sometimes because patients they will not follow the proper instructions. Again, they'll go into the same lifestyle habits. There may be chances of recurrence. We can't give 100% guarantee that no one will have a recurrence with laser. That's not true. It's a myth again.
Thank you, doctor. Now, the next question is, how safe is laser surgery for elderly or diabetic patients?
Elderly or diabetic patients, yes, comfortably they can undergo laser surgeries. There is no restriction at all pertaining to age or diabetes. So laser will help for diabetes and old age patient, and it is even advisable, more advisable, because old age patients, they can't bear the pain. They'll be anemic most of the times. So if we follow the conventional procedure, there may high chances of bleeding, all complications, even infections. Elderly people, they have low immunity. There are high chances of infection. So with laser, all we can avoid, even for diabetics. Diabetic patients are highly prone for infections. So with laser, definitely there will be minimal chances of infections.
Thank you, doctor. My next question is actually connected to the previous one. Um, do all patients qualify for laser treatment, or are there specific cases where traditional methods are still preferred?
Yeah, sometimes not exactly traditional, but sometimes we use both. Depends on the grades. Like if it is a grade 4 hemorrhoid, or like it is prolapsing, there are a huge cauliflower type of hemorrhoid. Yes, definitely we use both laser and even traditional method. We'll excise the tissue with a blade or knife. Then we will even stitch the dilated vessel. So all this will combine. We'll do a hybrid approach then. So it is not necessarily only laser helps for everything. It is not true. Traditional is always traditional. These all modifications of the traditional method. So laser definitely helps in few things. One is it will restrict some bleeding. It will be precise in cutting. So these things definitely helps a surgeon and patient as well, but not necessarily only laser. We can use hybrid approach most of the time if they are complicated.
Thank you, doctor, for that answer. Um, Finally, what message would you like to give to people who delay seeking treatment due to fear or stigma around rectal diseases?
So this is one of the most important question people need to understand. One thing is you should not suffer in silence with these pathologies. It is much more advanced now. We have videoscopies, we have laser, so nothing to worry, very minimal bleeding, minimal pain. You will be recovered in 1 or 2 days. Within the same day or the next day, we will discharge the patient. So even for grade 4 or grade, if the hemorrhoids or piles are prolapsing, even for chronic fistulas and fissures, no need to suffer in silence. You can reach your surgeon at any time, and you can reach me. I am Dr. Raghuteja, Senior Consultant at Onus Robotic Hospitals. Anytime I'm available here full time. So, so don't worry, don't suffer in silence. We are here to clear your pathologies or diseases. It is so important to get it done if you are suffering from these type of problems today.
Thank you so much, Dr. Raghuteja, for those clear and insightful answers. Before we let you go, we thought we'd end today's session on a lighter note with something a little fun and spontaneous. We call it our rapid fire round. I'll ask you a few questions, which would be quick and funny as well. And you have to answer them in just a few words or one sentence. No thinking too much. So, ready, doctor?
I'll try. I don't know.
Okay, let's begin. So,
Yeah.
one word to describe laser surgery.
One word to describe laser is
Quickly.
laser is
Probably precision.
precision. Yeah.
Okay. A common myth about pile treatments you wish to bust once and for all.
Piles treatment myth is in. Let me think. Yeah. You have not mentioned this rapid fire.
It's impromptu though.
Okay. Common myth. So can you repeat the question?
One common myth you would like to bust regarding piles treatment.
So that is what in laser, there'll not be no recurrence at all is a myth, because sometimes there'll be a recurrence coming if it is a patient's lack of follow-up or something like that.
Okay, great. All right. The most satisfying part of being a surgeon?
The how the patient improves or his smile after surgery, that gives us a lot of satisfaction.
Oh, that's lovely. So if not a doctor, what would you have been?
What would I have been? Maybe a lecturer or professor. I like to teach students.
Oh, that's great. So one health habit you never skip, no matter how busy your day is.
Workouts and my diet. I'll do intermittent fasting daily, and workouts every day for like 20 to 30 minutes. I'll not miss this.
Oh, that's great. That's inspiring. So what's your go-to stress buster after a long day in surgery?
I'll play with my kid. I have a kid. I'll play with my kid after my long hours. That gives me a lot of stress relief.
Okay, okay, that's great. So the one thing patients often say after a successful laser procedure.
They will feel like too much happier, like their face will be glowing, because it is it is a hell for them for like years or months together. They will suffer with these problems. So it will be like too much satisfaction for them, because there will not be minimal pain, minimal bleeding. So that satisfaction is most important, and they'll be very much happy.
That's good to hear, doctor. The future of proctology in one word.
The future of proctology in one word is yeah, laser and AI. There'll be good innovation coming up.
That's great, great. So if you could give one piece of advice to everyone watching today, what would it be?
My advice is this: lifestyle changes are much more needed these days, because all patients I see in my OPD are software IT people. So young people. Previously, they used to think that only old age people suffer, but not, even young people are suffering. So my advice is lifestyle changes, hydration, avoid constipation, high fiber diet, and proper workout, exercise. That's all.
Great. That was fantastic, doctor. Thank you for playing along and
Yeah.
for keeping it so real and relatable. I'm
Thank
sure
you.
our
Thank you.
audience enjoyed seeing this lighter side of you after such an informative session. So that was fantastic, Dr. Raghuteja.
Thank you. Thank you so much, Ajay. Thank you.
Thank you for taking our rapid fire in such great spirit. It's always wonderful to see the person behind the professional.
Super.
So,
Thank you.
so as we wrap up today's session, we'd like to extend our heartfelt thanks to Dr. Raghuteja Padma for his time, expertise, and valuable knowledge. Doctor, your clarity and commitment to patient care truly reflect the spirit of Onus Robotic Hospitals, combining advanced technology with human touch. So big thank you as well to our participants for joining us today for laser logic myths, mechanism, and mindset in proctology. We appreciate your engagement, your questions, and your curiosity. Before you leave, please take a moment to fill out the post-webinar survey that will appear on your screen. And you could alternatively fill it up from your email as well. Your feedback helps us understand what you found most valuable and how we can help and make our future sessions even better. So stay connected with Onus Robotic Hospitals for more upcoming webinars featuring our leading specialists across various disciplines. Once again, thank you everyone for being with us today. This is your host signing off. Stay happy, stay healthy, stay informed, and see you at our next one. Thank you.
Thank you. Thank you. Bye.